Hey, welcome back to Paramedic Project. Thanks for joining us once again. Today, I just wanted to talk a little bit more about the process that go on in the front of the ambulance between when we receive the case and when we actually arrive on scene. I've talked about the role of the driver, role of the passenger in this information exchange and in safe driving practices. But today's episode really refers to both the driver and the passenger, and that's in the case preparation. Now, from when we receive the case, either on the data terminal or on a cell phone or a mobile phone or a pager, to when we arrive on scene, that sort of time window for me is a really important, it's an often neglected time window in paramedic practice. It's something that people who are really good at the role, they utilise that time extremely well to prepare themselves for the case. So when I'm talking about preparation, first of all, I'm talking about looking at the information coming through, thinking about the information, the presenting complaint for the patient, starting to ask ourselves that question, what is happening for the patient, going through some different causes of the presenting condition to really get a game face on, get our mind and our mind in gear, just to take us from driving along, driving back to station, listening to music or whatever we're doing, to then getting in work mode. So that's a really important thing to do. Start going through those differential causes of the patient's presenting complaint. Second thing I like to do is I like to start thinking about some pharmacology or procedures that I might have to do if this patient's really, really sick. I always start with my worst case scenario and work forwards from there, and start preparing some of those calculations, and start thinking about when it's appropriate to do those procedures and when it's not appropriate to. So that really allows me to bring some of that thinking that would normally happen down the road when we get on scene back into the ambulance, so that when we get there we can really do the things on scene extremely well. We've already done a little bit of the thinking beforehand. So that's another source of preparation. The third way I think we prepare now is it really allows me to get my defences up a little bit. You know, it allows me just to review my primary survey, start thinking about sources of danger with the case as well, and then really focus on looking for that when I'm arriving on scene and when I'm approaching the patient. It also allows me, when I say get my defences up, it just means that I'm acknowledging that when I get on scene, I'm going to be the calm one. I'm going to be the one that is communicating really, really well. So I like to just get my mind in a good state to do that. You know, we're walking into people, we're not seeing them at their best. Often you're dealing with distraught families, distraught patients. So it's really important that we're the calm one. That's the expectation that the patient, the community, and our employers have. So it's a good time to prepare for that as well. And all this information then, I think too, really provides us with a wealth of information for later critical reflection on our performance. And the performance of the case for me starts now. You know, if there's some really important piece of information, some drug calculations or pieces of pharmacology or procedures that I don't know off the top of my head, it's a really good time now to acknowledge that limitation of knowledge. Actually check it if we have time to on the actual way to the case, or after the case, actually think back to this preparation time and think, where was my performance lacking and how can I improve? That's a really good thing to think about. And also, if there are certain cases I'm getting particularly stressed about, that might be a real trigger for me to go back and either do some education for myself around those cases, so that I'm more comfortable approaching those cases. Or it might be a good trigger for me to go and talk to one of my workmates or talk to a counsellor about the particular case if I find myself getting really, really stressed in this time period between receiving the case and actually arriving on scene. So that's why that time window is so important. That's what I do during that time. It's a really good thing to think about. It's a really great thing to incorporate into your paramedic practice. So thanks for joining us once again. It's been Paramedic Project. Find us on social media. We'll see you next time.